you show me where you do it? Can you point on your face?
Yeah, sometimes I do it right here.
Okay, all right, well that's really pathological. I mean, this is child abuse? Let's react to this video called Your Botox Has Backfired.
People are like, what do you ask for when you go in? I'm like, I just go in, I'm like, me up, fam. I don't want to see any movement. Like, if I can move my eyebrow 1/4 of an inch, I'm suing. So just pump me full of it. What parts of your face? I'm like, everywhere. Everywhere the light touches is Botox.
Some people I feel like use Botox and filler interchangeably, but they are very different things. So it's important to keep that straight. Because some people will say, yeah, these lines here, put some Botox in them. But if you do that, you're going to have a wonky smile. These areas, the nasolabial folds, is where you normally put filler. So again, it's important to understand the differences between the two.
You can even do it yourself.
In the pharmacist shop, they were selling Botox kits that you could buy and bring home and do it yourself Botox.
These are actual medications that should only be purchased from the authorized manufacturer. This is not something that you should buy yourself randomly and start doing it at home. That's not a good idea. Botulinum toxin is one of the strongest toxins known to man. It's just that we're using it in very small dosages for aesthetic purposes, but if it's mishandled, it can be quite dangerous.
Today, I'm going to be giving myself some Botox because I have one wrinkle here. I am not a professional, so I'm gonna be going in my forehead.
Oh my God, where are the gloves? There are no gloves. I highly doubt that anything was cleaned on the skin with alcohol or anything else like that. And you just have a person who is not properly supported, right? You can see that there's no head support. His head is all the way over to the side. It's difficult to be accurate in cases like this. And it doesn't seem like this is anyone who's actually licensed to perform this type of procedure.
Suitable for adults, children.
We met a pageant mom who says her 8-year-old complains about wrinkles.
Okay, all right, well that's really pathological. Oh my God. Oh, I didn't realize people were starting that young. I mean, that's crazy. That's really crazy. Everyone is going to have some degree of dynamic wrinkles. That's like when you move your face, there are some lines that form. My 5-year-old has that. That is normal. This young 8-year-old little girl has that. That's normal. That's completely normal. Even static lines are normal, but we see it sometimes as an aesthetic concern, but not for 8-year-olds. I mean, this is absolutely absurd. Why would you ever put a toxin into an 8-year-old's face?
You know, a lot of the moms there, they're giving their kids Botox.
Can you show me where you do it? Can you point on your face?
Yeah, sometimes I do it right here.
That's not even an area that's normally injected with Botox. I mean, what the hell are they doing? This is nuts.
Well, do you do it because you see wrinkles or?
Oh yeah, I see like wrinkles and
These pageants for young kids really ought to be just banned. I mean, I really feel strongly about that. I don't know why a parent would want to subject their young kid to this pageant lifestyle where they're trying to perfect every little thing about an 8-year-old's face. Just don't know how you can defend this type of treatment of young kids. And also, where are they injecting the Botox? What muscle are they targeting in this general region? They're going to start to hit muscles that are involved with core functions like smiling, like eating, like speaking. Right? Imagine doing that to a little kid. I can't believe this goes on.
What does it feel like to get Botox?
it hurts.
Do you cry?
A little.
I mean, this is child abuse. I don't really know what else to call this. I mean, this should be highly illegal.
Does it look better after you get Botox?
Yeah, it looks way better.
I know that she was complaining about her face, having wrinkles and things like that. I do the Botox myself.
Putting her into pageants, what do you expect?
Do you worry about long-term effects of Botox? In her, 8 years old?
Do I worry about it?
How about short-term effects? How about all effects? I mean, this is all bad.
And even your favorite furry pet.
Would you believe dogs are actually getting doggy Botox?
What? Safe and effective, and if there's any real side effects, we won't tell you about them because that could impact our bottom dollar.
Diga Yutan River says it was the first time she'd had Botox, but that afternoon, the mother of one says she was hospitalized.
My tongue started swelling up, my lips started swelling up. I felt tingly all over my face and I was sweating and wasn't able to see or hear properly.
Like any other medication introduced into our bodies, we can always potentially have an allergic reaction to it, and no different with Botox. So anytime anything new is introduced like this, one needs to be aware that an allergic reaction is possible, and that can include some of the symptoms that she's describing, like the tongue swelling, things like rash, things like difficulty breathing. Sometimes it could be an actual anaphylactic reaction, but also keep in mind that if you're injecting Botox into, say, the neck, right, to fight some of these platysmal bands that we can develop, you can impact some of the muscles involved with our swallowing and breathing capabilities and get some of these effects that is not necessarily anaphylaxis, but it can actually inhibit the muscles that control these core functions.
This is a snapshot of severe adverse events after using Botox. 3 days after receiving 20 units of cosmetic Botox from a London-based clinic, Carolina experienced catastrophic adverse events, which progressed to severe neurological issues. She experienced difficulty with comprehension, speaking, followed by stroke-like symptoms, extreme fatigue.
Yeah, especially when people have some underlying pre-existing neurological symptoms or conditions, they really need to be very careful before introducing Botox into their bodies, even in small quantities. And for cosmetic clinics, it's always a balance between informing patients of the actual potential side effects, which can be extremely lengthy, right? If you look at the insert that Botox comes with, you could be reading it for a full day about all the different possible things that can happen. So trying to balance that with potentially giving people enough excitement about getting rid of their wrinkles and actually selling the service. There's always this balance, right? So for example, if you tell a patient that we're going to read to you all the side effects and everything bad that can happen to you for the next hour, chances are they're not going to sign up for the procedure, at least not in your clinic. But if you don't inform them of the potential risk, then you're really not doing them a fair service, right? So finding that right balance is something that every provider and every clinic has to figure out for themselves, but surely there's a healthy balance that can be reached there.
Is it any wonder that billions of women worldwide have fallen for the Botox lie? When 21-year-olds think they're old.
21 is old. I've had it here, I get it across my brow.
But at 21, she thinks she's looking old.
Young women and a startling new trend turning to Botox before they can even legally buy a drink.
They call this prejuvenation, right? And the idea is that you can prevent lines from forming, which some people consider to be a good thing, but we need facial expressions to actually emote and to show people how we're feeling, right? There are also other issues with starting Botox injections early in life. And one of those is that you're going to weaken those muscles over time, and you can cause atrophy of the muscles. So it's possible, for example, with over injecting the forehead, that you start to drop your eyebrows, because that's the only muscle that actually pulls our eyebrows up. All the other muscles around that area pull the brows down. So the frontalis muscle, if weakened with Botox or other neurotoxins over time, can actually lead to a weakening of the brows, where the brows start to sag lower and lower and lower, which then for some might necessitate a brow lift.
Young women and a startling new trend turning to Botox before they can even legally buy a drink. What 20-year-old Heidi Huff wants to fix are the premature lines she sees when she looks in the mirror.
And the other thing about some of these younger women starting to get Botox early is that they're actually starting to look older. So like that 21-year-old who said, I actually want to look like I'm 18 again. By getting the Botox, she's actually starting to look older rather than younger. So it could actually lead to this paradoxical aesthetic effect.
I actually didn't even notice my wrinkles until somebody pointed it out to me, and then I really noticed it.
These are not lines. They are not wrinkles. If you have a forehead and you raise your eyebrows, your forehead skin is going to crease.
Well, they are wrinkles, but they're dynamic wrinkles, and that's what I was alluding to earlier. They're not static lines, and I think that's what Stephanie is getting at. She's trying to draw the comparison between static lines, where just at rest you can see these wrinkles that have formed, versus folds and wrinkles that form when we animate. That portion of it is very normal, and we see it in young kids as well, and that's not something that should be modified with Botox. It's when we start to form those static wrinkles that some people turn to Botox.
And it's not just impressionable young women like Heidi who are falling for this preventative Botox scam. I know I certainly did.
Okay, so probably the next most controversial thing I've had done would be Botox. I'm 27, by the way. I'm not a young person, so I think that I can get Botox if I want.
Oh, that's Stephanie when she was younger. Cool.
Now, obviously, I don't get Botox anymore. I mean, seriously, guys, look at these, and these, and these. But for those of you who are still being hoodwinked by the Botox lie, hate to break it to you, but based on new research on Botox, we now know that not only is preventative Botox not going to stop you aging, it's actually going to make you look older faster.
And that's what I was talking about earlier, where you're starting to weaken those muscles. So the muscles that normally, for example, raise the brows are now starting to weaken, and the brows can start to descend. And sometimes it can actually work against you to get the baby Botox, right? You might think if you're fully paralyzing that muscle, wouldn't that be the worst thing you could do to it? If I just get small amounts of Botox, maybe that's okay. But that can also work against you, because as your muscles are trying to figure out, are you paralyzing them? Are you not paralyzing them? They might actually start to overwork.
Whilst you've been dutifully having your Botox injected into your face for months and years on end, you're actually causing your face to age faster. And listen, no judgment from me. I've been there. I've done it. So how is it possible that preventative Botox can make you look older? You would think that if you start getting Botox young before you really develop wrinkles, you'll basically prevent them from starting, and thus you'll look younger for longer. And who wouldn't want that? Sign me up. But there's one very important fact that people seem to forget. It's not just wrinkles that makes people look older. What really makes people look older is the sagging and drooping of their facial skin and muscles.
It's that, and of course it's volume depletion, and it's volume depletion at all levels. You have the skin level, you have muscles, and you have the bone, and all of that atrophies as we age, and that gives that sort of sunken in, depleted appearance. So it's that, along with the effects of gravity and weakened muscles, compounded by the potential effects of Botox that people are starting so young. All of that is leading us to this more aged appearance that is part of aging, but can also be accelerated with the use of Botox. And I think that's what Stephanie's getting at.
If your injector is even a millimeter off target, at worst, you can end up looking like this poor girl who had Botox done the day before her wedding and then lost the ability to smile. Look at her smile.
We usually recommend not getting anything done for at least a few weeks leading up to an important event. So not something you want to mess with right before. And remember, with Botox, the effects are not instant, right? It takes at least a few days for you to start to see the impact of the Botox that was injected. And for full effect, you have to wait at least 2 weeks. So if you have a big event, you don't want to wait until just a few days before to get these injections done. Because if you need to do any corrections, it's going to be hard to fit that in before your big day.
Or influencer Whitney Booha, who had her routine Botox injection just that little bit off target, and next thing she knew, she went from looking like this to this.
Yeah, it's possible to get ptosis after these types of injections around the eye. If you inject too close to the levator muscle, you can actually cause weakness of the upper eyelid, and then you get this droop that lasts for months and can be extremely disruptful to someone's life. The trick in trying to avoid this type of effect is to not inject too closely to where the orbital rim is, and always leaving at least a centimeter of space between where the orbital rim is and where the injections are placed. Usually you're able to then avoid this type of diffusion effect into the upper eyelid. But of course, that's why it's really critical to go to an experienced injector and not someone who does it, once in a while or doesn't exactly know their anatomy. But even in the best of hands, it's possible to get a complication.
Or at best, you might simply end up looking like Spock.
It's like it's frozen or something.
The main reason is because the Botox injected into the forehead or the frontalis muscle is typically not injected laterally enough by many injectors. So they're just injecting where they see some horizontal lines rather than understanding where the full breadth of that muscle is. The muscle will stop around the temporalis line here. And so if you don't inject all the way lateral to where that frontalis muscle ends, you can get lateral movement still of the frontalis muscle, raising the lateral brow and giving you this Spock eye type of appearance. The way to remedy that is usually to inject additional Botox units into the lateral frontalis, allowing that eyebrow to adjust back down.
Think about what happens to a muscle that you never move. What happens is that over time you begin to lose strength and muscle tone.
If you don't use it, you lose it.
Because muscles that you never use become weak. And weak muscles begin to sag and waste away. Which isn't going to make you look younger, it's going to make you look older. And it's basically the opposite of what you want when you're paying someone to inject your muscles with Botox. Fair enough, you may not get wrinkles, but the trade-off is a droopy, sagging face caused by the Botox.
And maybe that's why some people are starting to get facelifts at an earlier age. I think there probably is some correlation between those phenomena. Getting Botox injected earlier in life and people feeling like, hey, I think it might be time for a brow lift or a lower or mid facelift, right? So that I think has some correlation here.
Look what happened to YouTuber Amy when she had regular injections of Botox to slim her masseter muscles.
I've always had a really round, full face and prominent jawline. So when I learned that you could do Botox into your jawline to make your face look more feminine and oval, I was like, sign me up! But when it comes to using Botox for facial contouring, you have to wait for the muscle to atrophy.
Remember that with masseter injections, some people do that just for the facial slimming element of it for cosmetic purposes, and other people get it done because they're looking to weaken that muscle that is involved with chewing, right? Some people have temporomandibular joint dysfunction, so they actually have some arthritis that is developing in the TMJ joint. And in order to combat that, they'll sometimes get Botox injections into the masseters to weaken that muscle, improving their TMJ pain. So that's one indication to get it, while other people are just trying to slim the face. And yet other people are getting it for both of those reasons. So just because someone's getting Botox to the masseter doesn't mean they're trying to slim down their face. They might be trying to weaken the muscle on purpose to help them with their TMJ pain.
After my last treatment, I started to notice severe hollowing of my face. Here's a photo. Check this out. This is me.
It's possible to overdo anything, right? So the dose that you inject is really important. So I wonder how much Botox she was getting injected into the masseters. It could be that maybe it was double the normal dose. I don't know. Usually a fairly standard dose with Botox is about 20 units per side. So was she getting maybe much more than that per side? I don't know, but that may have contributed to that more extreme type of appearance.
I could feel the bone back here.
And usually that process occurs gradually, so to really get that muscle to atrophy a great deal, it requires repeated injections every few months. So I wonder how many times she had this done. Was it over the course of years, going back there every 2 to 3 months to get it injected? Because if it was just done once or twice, I doubt she would have had that type of appearance.
Have you ever seen an arm or a leg that's been in a cast for a long time? Because the person can't move the limb that's been in the plaster cast, the muscle in that limb that's not being moved gets so weak that sometimes it can even waste away. So if you compare...
I once broke my left wrist and I had a cast on for 3 months, so I definitely remember how much thinner it looked when the cast came off.
Look at people who have been using Botox in their early 20s. What you'll notice is they have very unnatural lines around their cheeks. There's nothing that we can do to treat those.
But remember, it's not like Kylie or most other people are just getting Botox in isolation. If they're getting Botox, especially at younger ages, they're probably also considering things like filler or maybe some other procedures as well. So all of that gets compounded on top of one another. So I think Kylie, from my prior analysis, I don't think she's a stranger to cosmetic plastic surgery as well. So you have the plastic surgeries, you have Botox, you have filler, and all of that is creating the perfect storm and changing our faces forever.
At least Dr. Tim Pierce is honest when he says injectors use the term baby Botox as a marketing tool.
Baby Botox is basically a marketing term. It is a story that we tell that enables patients to feel a little bit more comfortable with having Botox at a younger age.
Well, it might be for marketing, but it's also usually lower doses that are used in some of these patients compared to some patients coming in at more advanced ages. So it might not be completely false advertising, but of course it's used in part as like a marketing tool to attract younger and younger patients. To me, it's similar to when people say, oh, I just had a mini facelift. It wasn't a full facelift. facelift. It was just a mini facelift. Well, sometimes mini facelifts actually look worse as far as the scarring goes, as far as the actual degree of lift. Sometimes a year passes and people look about the same as they did, before the surgery took place. So just because it's something mini doesn't mean that it, doesn't carry risk. It can also carry significant risk, and it can give you a worse result than getting a deep plane facelift that's done properly. So the same goes for Botox in many ways, but that's just one kind of comparison that I thought of there.
And it gets worse. If you've had Botox in the past or currently have Botox, what I'm about to tell you is probably going to horrify you.
I think Stephanie does a lot to kind of scare people away from many of these procedures, and most of the time I agree with her on most of her points. I mean, I think she raises some excellent thought-provoking, messages that I think we all need to hear. And we need more and more people to actually hear these messages, right? So they can stay safe. But I think it's also important to discuss, well, what are the options for people when they're seeing signs of aging, or they may have some facial features that they really don't like? Like, what can they do about those things? And sometimes I think the answer is to do nothing and to just wait it out, or to use makeup and other kind of non-surgical things. But what can people do? And I think that's something that doesn't really get addressed as often. So I think it's good to raise awareness, but I think we have to also be careful with potential kind of fear mongering and not giving people actual options that they have to make decisions that maybe are right for them.
Know how the powers that be advise pregnant women to steer clear of cured deli meats like ham and sausage, and infants under the age of 1 to strictly avoid honey? Well, that's because honey and deli meat have been known to be contaminated with the deadly bacteria Clostridium botulinum. Now, what the hell does bacteria have to do with Botox? Well, Clostridium botulinum produces one of the most deadly toxins known to man. Botulinum toxin. Sound familiar? It should, because this deadly toxin is exactly what we are paying people to inject into our faces under the brand name Botox.
Again, it's more controlled dosages than what you'd find in, say, contaminated honey. And we're talking about injecting adults. I mean, even if it's an 18-year-old, it's still an adult compared to a baby, right? So there are some differences there. But yes, it's the same general toxin.
So how can we possibly know for certain that repeatedly injecting this deadly toxin into our facial muscles is safe long term?
Yeah, sometimes we don't know what we don't know, which is kind of a scary thought. We look back on some of these things, that were injected, back in the day, and it looks completely crazy. But yeah, maybe people in the future will look at us and say, what were these people even thinking? I guess time will tell, and more research is definitely warranted. So again, I think it's great to raise this level of awareness and concern about the things that we're doing in the cosmetic world.
It seems as though not much has changed in a few hundred years, and us girls are still quite literally poisoning ourselves in the pursuit of beauty.
And it's not just girls, it's also guys that are getting Botox injections to look more youthful, and they're getting it done too.
Considering the fact that Botox is quite literally a neurotoxin, and human bodies don't really like toxins, and it's kind of your body's job to expel toxins so you don't die.
Alcohol is also a toxin, right? So, people drink alcohol for various holidays, for just leisure, and that is very much a poison as well, right? That our body has to detox, out of our systems, and yet it's marketed and it's sold, and we already know for a long time all the harm and damage that it can do to the body, to the brain, to the liver, right, to other organs, and yet it's something that people still do. And we always say, drink responsibly. So is this something where it's like get Botox responsibly, where small amounts placed into kind of select areas safely are considered okay, versus overdoing the dose and starting too young, doing it too often can be the harmful thing? What about cigarette smoke? What about vaping? We have a video that compares vaping to cigarette smoke, and points out that vaping is not much better, right? So that also can be extremely harmful, but we still do them. I mean as a general society.
Filler is lasting for a lot longer than we think.
Botox, on the other hand, actually is temporary. And so, if you want to keep the wrinkles at bay, you need to keep those facial muscles paralyzed. And so, you need to get repeat Botox injections.
And now there's a type of Botox that lasts much longer than the typical type of Botox. So instead of 3 months, you're looking at something like Daxified that can last 6 months plus sometimes, right? So imagine having some sort of eyelid ptosis or a smile that's irregular and having that last for much longer than the standard Botox. And that's sort of what we're getting into now with these longer lasting variants of Botox.
What happens with these repeat injections of the same toxin is that after a while, your body's like, hang on a minute, what's going on here? I keep being exposed to this same toxin over and over again. This is not good for me. I better do something about this. And so your body, which bear in mind is incredibly wise, will develop antibodies to Botox in an attempt to try and protect you from the toxin. So if you
Yes, that's true. Some people need a higher dose of a Botox type that they were already getting, yet other people need to switch over to a slightly different version of Botox. There are different botulinum toxins that exist, and sometimes you need a different variant because you may have developed resistance.
we are not using Botox now the way it was designed to be used. And I think this is part of the reason why instead of making us look younger, it's actually causing us to age more rapidly. We're using it incorrectly. As humans, we're designed to have the ability to frown when we're angry, to smile when we're happy. And smiling isn't just your mouth, it's not just baring your teeth. When you truly smile, it shows in other areas of your face. Your eyes light up, your face crinkles into light, hence laughter lines. This is literally part of human communication. Kim and Kylie are the perfect examples of Botox gone wrong. Like, what is this? This is not a real smile. It doesn't reach her eyes. It's hard to even tell if she's grimacing in pain or laughing. This is the eerie effect of artificially altered human expression.
Yeah, I don't know what's worse, not being able to show emotion or a couple of lines on the face. I mean, I guess everyone has to decide for themselves, but I think it is nice to be able to see people's actual emotions. I'm with Stephanie on this one, and I think that there's definitely a balance between softening some of the lines that may appear with the aging process versus completely erasing them from the face, never to be seen again, right? And it's also, I think, one thing to have like seen your face with wrinkles and to be like, hey, I don't like the way that looks, versus like never having seen wrinkles really forming on the face and to just have prevented it forever, because you never really get to see how your face would have naturally looked, right? We're just kind of preventing that from ever happening. Just like getting facelifts way too early in life, where you don't really know what it would have looked like to have, a little early jowling, a little bit of change, maybe it wouldn't have been so bad. But instead, people are kind of jumping on the various cosmetic bandwagons and getting things done very early on. And they'll never know how else it would have looked. And maybe they would have been okay with some of the aging changes. But yeah, this has become big business, for clinics all around the world, doing these types of injections. And the companies that create these various toxins have become a lot more wealthy. And so the machine just keeps going, and it's hard to pause it, right? And say, hey, maybe we should take a step back and really assess if we should be doing this. I think like AI is something similar, where it's like the companies are now competing against each other, and it's hard to put a stop to it now, right? So we'll see what comes of AI or what comes of all these various toxins, but surely the cat's out of the bag, and it's hard to put it back in.
And here's the thing. There are two different kinds of wrinkles. One kind, Botox, is designed to prevent. And the other, you actually want to keep. Have you heard of the term static wrinkles? Dynamic wrinkles? No?
This is what I was saying.
Botox was never designed to permanently paralyze your face. Botox was intended to prevent the development of static wrinkles.
Not just to prevent, but to actually treat the static wrinkles. I would argue that classically, you'd have to wait to see that you had some lines that were not going away and then get Botox for those lines to soften them. But now people are trying to prevent the static wrinkles from forming in the first place. Once static wrinkles get fully etched in, and if they get quite deep, they're very difficult to treat. And sometimes that can also come with its potential complications and risk, right? Like if you have glabellar wrinkles that are very deep. So if you try to treat them with like, let's say a filler, right? To kind of fill that deep furrow, that can actually be more risky than using Botox earlier in life, because that filler has a thicker consistency and can get get into a blood vessel that could potentially lead to something like blindness or necrosis. Whereas Botox is a much smaller molecular weight molecule that even if it gets into one of these blood vessels is not going to block up the blood vessel. That's one of the reasons why people are getting Botox earlier, because they don't want those deep lines from setting in. So again, like anything in life, there's usually like a happy in between, right? You don't have to go to either extreme.
I've been getting treated with Botox Cosmetic for about 8 years.
Whoa. So this lady has been getting Botox for 8 years, every 3 to 4 months. Now I'm no good at maths, but if I calculate that, that's about 32 separate sessions of Botox.
And it gets really expensive too. If you see some of my celebrity analysis videos, when I get to the pricing at the end, a lot of that cost is actually because of the non-surgical treatments rather than just the surgeries. When you add up all that Botox and filler and laser treatments, the price really adds up. And sometimes that can add up to more money than the actual surgeries that people have gotten.
That's a lot of neurotoxin going into one face. And bear in mind, guys, this is an official Botox brand advertisement. They are literally promoting this amount of injections as being normal.
And there's a lot of incentives for providers to inject more and more, because the more you inject, the more you buy from, say, Allergan or the companies that make Botox and similar neurotoxins, the cheaper the product becomes for you. So if you buy in bulk and you're high volume, meaning you're injecting people over and over and over again, then you're able to buy at a lower price. And then you're able to have more of a margin there for your own profits. So everyone's benefiting financially except for the patient.
It's a quick 10 to 15 minute treatment every 3 to 4 months that leaves me looking like myself, just with fewer lines. You can start to see my moderate to severe lines appearing since my last treatment 4 months ago.
I'm sorry, but I am not seeing these moderate to severe lines that they speak of. This is severe lines. This is not severe lines. Please do not let these companies brainwash you into thinking that a woman that looks like this has moderate to severe lines.
But again, I think it's very important, like what I said earlier, once those lines get so deep, they're very difficult to treat. And the amount of money and time and pain that you might go through to treat those really deep lines might be a lot worse than some of these Botox injections. So I think that's something where maybe Stephanie will touch on that, but if she doesn't, I think that's super important to point out.
Injections feel like just a little pinch, so nothing too painful.
People have different nerve sensitivities. Some people just really are not bothered by it at all, while other people can surely feel some pain with the injections. So it's depends on the individual. And of course, it depends on the injection technique.
And just like that, we're done. The aftercare instructions my provider recommends are super easy too. No working out for the rest of the day and keeping your head elevated for 3 to 4 hours.
So you know how they very briefly touch on the fact that you shouldn't work out after getting Botox? It's because if you work out or exercise, and that includes running for the bus after getting Botox injections, that can literally cause the Botox to spread throughout your face and body and paralyze other areas of your face and body.
Okay, that it's usually not that extreme. From someone who used to inject Botox, running for the bus or doing some light exercise is not going to lead to what Stephanie's describing there almost ever. So again, it's good to raise awareness, but we don't need to scare people into thinking, disaster is going to strike, when in reality there isn't good data to support, not doing most things after actual Botox injections. Most activities are very safe, even the same day that you get Botox injections. So talk to your provider, see what their instructions for you are, but know that in general, you're not going to all of a sudden have this stuff spreading all over the body just because you went for an extra jog or, did some basic activities. So we don't want to scare people unnecessarily.
Now the Botox industry isn't just targeting women, it's spreading its poison to men.
My name is Javi. I'm 31. I'm a fitness instructor, and I got Botox Cosmetic. I saw myself in a photograph, living my best life. I was on a vacation, and I was with my friends, and we were on the beach, and we were all smiling. And I looked closer, and I was like, that's what everybody sees? The lines.
But you see, he still had some movement there.
Just like in this video.
But he doesn't anymore. Not after that Botox. Some people ask me if I've had Botox, and they also think I have lip injections. Listen, if I got that, I would definitely film it for you guys and put it in a video. Like, why not, right? So just so you know, can you see it? I have lines. I don't do Botox, but maybe I will one day. I don't know. And then no filler in these lips. These are natural, you know? There's nothing settling anywhere. They're my natural lips. I'll show you pictures of when I was like much younger. It was just the way my lips are. I talk on my channel all the time about being more transparent, you know, about any kind of work. And I think more celebrities should do that. And so, of course, I would be transparent. I'll tell you, the first procedure I think I'll end up getting will likely be my under eyes because of the hollowing, but I'm good for now. Maybe down the road.
There's also so many natural ways to keep your face looking healthy and youthful for as long as possible. Eating a really good diet. I know it seems boring. It's not as easy as just getting an injection into your face.
Skincare from Feel Confident, another great way to keep your skin looking pristine.
But eating a good diet, organic if it's in your price range, full of nourishing whole foods, drinking plenty of good quality water, and here's what I do, eating lots of vitamin C. If you eat vitamin C, it actually helps your body to synthesize the collagen.
There's also vitamin C in our moisturizer, so make sure to check that one out. It's a great product and we've gotten great feedback from thousands of customers.